Welcome to the University of Florida College of Medicine Ultrasound Module. Today we're going to talk about the heart. At the end of the lab, you should be able to identify the four cardiac chambers, the interventricular septum, the cardiac valves, the aorta, the inferior vena cava, and understand direction of blood flow through the heart using Doppler. We're going to start with the parasternal long axis. I want you to place the probe on the left parasternal border at the level of the 4th to 5th intercostal space. The probe has an indicator. It's a small dot. I want you to make sure that that dot is pointing towards the patient's right shoulder. Let's review the anatomy. On the top portion of your screen, you're going to see the right ventricle. The left ventricle is going to be on the bottom part of your screen, along with the left atrium, the mitral valve, the aortic valve, along with the aortic outflow tract, papillary muscles, and then you're going to be able to see the chorda tendineae. Let's look at the ultrasound image. The right ventricle, the left ventricle, the left atrium, the aortic outflow tract, the descending aorta, the aortic valve, and the mitral valve. Let's see the heart in motion now. Let's move on to the four-chamber view, apical view. I want you to move your probe towards the precordial area. We're going to be at the midclavicular line around the 4th to 5th intercostal space. And now our indicator is going to be pointing towards the patient's left shoulder, giving us the apical view. You're going to have on the right side of your screen the left ventricle, the left atrium, on the left side of your screen the right ventricle, along with the right atrium, and of course you're going to see the mitral valve and the tricuspid valve. Indicator towards the left axilla. Let's see the ultrasound picture. Left ventricle, left atrium, right ventricle, right atrium, and the corresponding valves. Let's talk about color Doppler. We use it to analyze flow through structures. And here in the heart, you're going to see red and blue. So red means towards your probe, and blue means away from your probe. In the heart, of course, you know that blood flow occurs from the atria, from the superior chambers to the ventricles. And from the left ventricle, it goes out through the aortic outflow tract. So red towards the probe, blue away. So using the ultrasound, you reviewed basic heart anatomy. And you should be able by now to identify the heart structures using the parasternal long axis and the four-chamber cardiac views. And you also had a basic introduction to flow using Doppler. So that was module number 2. When we looked at the heart, we're going to see you in the lab for the hands-on. Hope you had a good time.